Hey, it's the Yong Form with the Yong brothers, Hossan and Stanley. And I'm pretty excited to get this episode underway because what we'll be talking about affects you and me, regardless of whether you've got thick skin or thin skin. You and I have so many topical questions, get it? That makes us scratch our heads. Now, if only you had a doctor on hand who's ready to tackle them. Why are you staring at me like that?
You wrote this script, right? And you had a lot of fun being punny, right?
I know.
So fun. We need a script writer. Ben. Anyway, we're in luck today because we have a dermatologist in the house with us, and we're I have to read this because you wrote it.
Itching.
We're itching to clear up the many misconceptions we have about skincare. And personally, for me, as an actor, so many years in the business, it's part and parcel of my job.
Yeah.
Because, you don't want to look like a pizza when you go on screen or on stage. And so we are going to be talking to my friend actually, that I managed to get him out of work. Haha.
Yay. That's what friends are for.
Exactly. And we have Dr. Martin Chio, who's our guest here on the Yong Form. He is a Senior Consultant Dermatologist with the National Skin Centre, and it's time to go under the skin with him. All right? So Stanley, you go first. Ask your questions.
But when we talk about skincare and how do we maintain our skin, it's often a topic that I think younger people gravitate towards because, they've got the future ahead of them, they haven't found a life partner yet, they need to look attractive and all, or the career depends on it. But, for us, who still have a long way ahead of us, but maybe not as long, we perhaps pay lesser attention to our skincare and skin health as well. Dr. Martin, do you agree that older people tend to perhaps neglect skincare?
I think we must go back to why we have skin.
Okay.
Why we
Let's
I have no idea why
from
we have
the
skin.
very beginning. Welcome, Dr.
Very
Martin.
good.
Let's start.
So the skin is not only just for us to look good or feel good and everything. The skin has actually got actual functions. Okay, it does protect us from the environment. It does prevent us from drying out. Okay, and it also has an immune surveillance function. Okay, it regulates your temperature through sweat. Okay, it keeps us warm. It's a barrier. It's got glands to treat various things. Okay, and it's basically protects us from the environment and, of course, the sun itself. So that's why skin is way more important than just looking good.
Thank you for bringing us back to basics. I mean, even that was like, wow. Straight away I went to okay, what
Mind
do we do
blown, right?
Yeah, so I mean, the skin is the largest organ in the body. And
that's true.
We focus on a lot of what's inside, but we also forget that what's outside can also affect us both mentally and physically and be signs of what's happening inside also. So if we think about that and the functions, we can focus on various things along the way, not only of the skin, but of the hair and the nails also, which are all part of what we do as dermatologists.
Okay.
Wow.
So the fact that older people aren't paying attention as much to their skin, do you see that happening?
I don't think it's really not paying much attention to, because I think we're focusing on other things. Okay, and then when something happens, then we forget, then we think about it. But I think skin changes over time, and when we are young, we should do certain things. When we are mid, we should do certain things. When we are older, we should do certain things. And some things start from right at the beginning. The main thing about skincare from the beginning is actually one simple thing in our lovely country: sun protection.
Oops.
And how early do you have to start?
I would never expose a baby to sun unnecessarily.
Oops.
Okay?
Your son.
Okay? But then
The sun.
the sun, your sun. But then there are times where we need to be in the sun and we protect ourselves accordingly, because no one's going to be wrapped under a blanket and staying indoors for nothing. Okay? But it starts from the beginning, and along the different ages, as we progress in life, we will do different things to maintain our skin, protect our skin, and of course, when we're much older, detect issues with our skin.
The thing is, it's very interesting that you say about sunscreen and sun protection, because here, often enough, there's cloud cover. And people mistake that, right? For, there's no sun, what? Why should I put sunblock?
Yeah, it's cloudy.
So that's a myth, right?
Yes. So despite having clouds, some UV does come through, and that can affect us. Okay, and depending on where you are, it also makes a difference. Let's say you're on a high mountain, less atmosphere there to absorb some of the UV, you get more sun. If you're on the beach, you have sun, You have reflection from the sand, reflection from the water, swimming pool, reflection from the water. If we are lucky enough to go skiing, for example, reflection from the snow. So all these things actually add up to the cumulative sun damage. And the more immature the skin is, the more susceptible it is to some of this UV damage. And UV damage is cumulative.
Oh.
So we get a lot of our sun exposure in our early years, for example, school, swimming, CCA, etc. Okay, then once we actually, for example, start working, we're mainly indoors, so we get less sun, but we get bursts of sun, let's say when we're out on holidays or on weekends. And of course, if you have an outdoor job, the amount of sun you have is totally different. So sun does play a part in some of the signs you see for people's skins.
So, yeah.
Wow.
You
I
take care of the
know.
sun.
Yeah. I can't handle the sun, but I can manage the sun. But you know, it's a good reminder because we just came back from a holiday across the border.
Legoland.
We spent a lot of time in the sun. I admittedly did not apply any sunblock. Did you?
I did.
Oh, you did.
I still turned red though. I still got a bit.
I am very red.
Yeah.
So yes, I think this is a
How
good
long
reminder.
is that exposure danger period? Is there a
1 hour.
It all depends on your different skin types. So as you know, there are different skin types around the world depending on your coloration. Okay, people who are Caucasian, people who are red, blonde hair, blue-eyed versus dark hair, dark-eyed, and then you have within Singapore itself all are multiracials, Chinese, Malay, Indian, all have different amounts of sun that can damage or cause problems with their skin.
Okay.
So people always think that sun protection is about using sunscreen, as you have rightly mentioned, but there are actually 5 steps. Sunscreen is probably the last. First is to avoid entirely.
Oh, cannot.
How?
Cannot.
Okay. Then next is to use an umbrella.
But for guys, come on.
Okay.
Hey, there's something wrong with an umbrella.
Okay.
Only when it rains.
A hat.
Okay.
Okay. A hat, I said, not a baseball cap, because you need to cover especially the tops of your ears. Okay. Then after clothing as in terms of thick weave knit clothing, so it actually protects you from the sun. And anything that is not covered by all of these, sunscreen.
I see.
So
Wow,
we
that's
always
major.
move back. We always think, sunscreen.
Yeah,
But
yeah.
you're actually avoiding is quite important also.
So it's major PPE for sun now?
Yeah, so I mean, and some sun is necessary because it also helps us produce some natural vitamin D. Okay, and which has been shown to have health benefits. But too much sun can lead to a lot of problems. People think that tanning is healthy. It looks healthy, but tanning is a response of the skin to protect the underlayers of the skin from the sun.
So when you turn brown, it's actually trying to protect.
Yes.
I see. Which is not good lah.
Not ideal.
Oh dear.
Hey.
Because I think when I was, for my job when I was younger, we all wanted to look bronzed and honeyed and whatever color you want to be called. And filming, we often neglect, especially the actors, to put sunblock underneath the makeup. So now, as I, in my mid-50s, I've got all these brown patches on my skin, on my face. Now you cannot see because
makeup,
good
is it?
makeup.
Okay.
But is this? Am I supposed to get worried about it or how?
I mean,
Or can I get rid of it?
you've got you're a young senior now.
Thanks.
PM Lee said it, not me. And of course, sun damage is cumulative. So as we get older, we do get more extrinsic damage from the sun itself. And for Asian races, okay, we tend to age with pigmentation rather than the Caucasian races, which tend to age with a lot more wrinkling. And for wrinkling, you can Botox. But for pigmentation, it's a bit more tricky and complicated. But there are ways to improve or solve the situation.
Oh, so you can kind of lighten the... I see.
Is it through laser and stuff?
Various topical lasers and everything like that. But back to the sunscreen thing.
Yeah.
I mean, people always think, you put a correct amount of sunscreen, you should be all right. But there are actually many steps to sunscreen.
Many steps to
What do
sunscreen.
you mean by many steps? Is
Yeah.
it just squeeze it out the tube and apply?
Slip, slaughter, is what they call it in Australia.
First, you have to get the correct sunscreen. We have on the bottles of sunscreen what they have. They put there sun protection, blah 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 blah. You need a sunscreen that has both SPF, okay, which protects against UVB, and of course something that protects against UVA.
UVA.
Yeah, that's many
That's
types of
new to
UV.
me. I thought it was just one.
Yeah,
Okay.
so you need to protect against UVA, which causes the aging bits, and UVB, which causes you to burn. The SPF that you see on the bottles, okay, that's the SPF 30, protects up to about 97%. Okay, but you have to apply it correctly also. Okay, let's say you're going out into the sun at 10 o'clock.
Yeah.
We always advise people to start applying the sunscreen about half an hour before you go out.
Half an hour before. We usually just apply it straight away before we jump to the pool or something.
Yeah, but then your skin needs to absorb some of the things
Right.
depending on sort of sunscreen you have. Okay, if you have a physical sunscreen, those made of zinc or titanium that you get very white or the what I call the opera wayang look, those are okay but for those that are chemical based, you may need some time for it to be absorbed first before it can be effective. How much sunscreen would you use for your face?
Yeah. Oh, you're asking us? Oh, okay.
Yeah, it's a conversation, and I'm not.
I normally squeeze like a dollop, and then I kind of pat it on.
I mean, be a bit more scientific. Dollop.
Dollop, about size of my thumb.
Okay, so for the face itself, okay, we take it as 1 unit. What you need is at least a teaspoon.
Teaspoon.
Okay lah,
lah,
my
about
thumb
thumb
lah.
lah.
Yeah. Okay. So you need to spread it evenly, and of course, if you're out in the sun for a long time, if you're sweating, if you're perspiring, or if you're swimming, you need to reapply.
Okay, that's for sure.
Okay?
Yeah.
So and then if you want to cover your whole body, okay, depending on the tube you get, they say about a shot glass or maybe half a bottle of sunscreen for whole body application.
That's a lot of sunscreen.
Yeah.
Wow.
So if you don't apply the correct amount, then you're actually not getting the SPF that's on the bottle.
But what if you're wearing clothes? You put it under your clothes as well.
No, I mean depends. I mean if you're wearing clothes that are thin weave, then if the sun gets through, then you apply under your
Still
clothes.
have to do all.
Yeah.
You like that.
So you get very sticky, unfortunately.
Yeah.
That's why I say umbrella.
Then what about those edible sunscreen?
Edible? What about edible
Have you heard
sunscreen?
of those edible
No,
sunscreen?
I've never eaten sunscreen before.
No, there are some products which, when you take, helps you decrease the amount of sun protection you want to apply. But they add on maybe about 2 or 3 factor of SPF.
Oh, that's not very much.
Yeah. So, but they also have other properties, for example, antioxidant type properties, which can help some of the sun damage. But it should not be used in place of topical sunscreen.
Okay.
Wow.
So-
Learned something new today.
Do you know what SPF means?
Sun protection factor.
Okay, so SPF only does for UVB.
Okay.
UVA is a different sort of thing. And so you should have adequate UVA protection on your sunscreen also, for which most major brands and most commercially available sunscreens will have both UVA and UVB protection. People also ask me if I use SPF 50 versus SPF 100, is it a lot better? It is more expensive, but they've done studies that show that SPF 30 protects about 97%, SPF 50 about 98%. So it's not each more SPF that you get. So the incremental is a bit much. So
So you
SPF,
just keep, constant
at least
application.
SPF 30 will be sufficient.
I see. Because when I was in Sydney over summer, it was horribly hot, no cloud at all, and that Sydney sun is very, very, very
burns,
lethal.
right? Yeah.
And I thought I had enough, and I kept applying, but it still burned through, which got me worried because the pigmentation really went. How do we? I guess it's like what you say, protect wear stuff and all that stuff.
Yeah, physical barriers are important, and there are umbrellas which have got coatings to really protect you from UV entirely. And you can buy these online. I mean, I think Australia itself, with the amount of skin cancers that they have got their game on, and you can buy products you can protect yourself from sun.
Is it a problem in Singapore, skin cancers?
We do. I mean, we run the skin cancer clinic, and we do see more and more people diagnosed with skin cancers, and some of them they come from all ages itself. So it is a problem. It is an issue, okay. But different types of cancers at different ages, but definitely not as young as we see them in our Caucasian population because of the sun damage and the type of skin. And we as Asians have melanin, the pigmentation, to help protect some of the times, but not all.
Yeah, because I read here in Singapore that the rate of skin cancer is considerably lower incidence of around 0.5 cases per 100,000. Is that still in effect?
I think it is in effect, but skin cancers still appear as top 10 cancers diagnosed in Singapore.
Really?
Okay, but majority of skin cancers are not lethal. Some of them are. The worst ones are, of course, like melanoma and stuff like that. But a majority of them are not lethal, thankfully, and you just need to be careful and check if you have spots that don't heal.
So what is the process if you got skin cancer?
No, you detect it. I mean, you have someone detect it, do a biopsy to confirm it, or you can do a scan to confirm it. And then after that, you cut it out and then...
Oh, cut out?
Yeah.
Oh.
And then it's the problem solved.
Oh.
And then a graft or something?
Depending on where and what and what size it has. So that's a simple explanation. But depending on type of cancers and the site of the cancers, you may have to do other sort of tests like scans and stuff like that just to make sure it hasn't spread or cause further problems elsewhere.
I mean, since we're on the topic of skin cancer, is there always a visual cue to say, okay, there might be a problem here, time to see a doctor?
Well, we always tell people, our patients, that if you have a spot that is changing, see someone. The spot is growing, it's painful, see someone. But I think if we can, the common things that we teach all of our patients and our doctors is ABCDE.
Which is?
Something that is asymmetric.
Oh.
Okay. Something that has indistinct or undefined borders. Something that has change in color. Okay, more than 2 colors. Okay. Anything that's the diameter is more than 6 millimeters, or something that's evolving or changing. And a wound that doesn't heal, or a lump or growth or ulcer that develops on a piece of skin that has a chronic condition in it, for example. Yeah, some autoimmune stuff. So
okay,
yeah.
That's a lot of indicators then.
Yeah.
I mean, one of them could actually be.
And of course, sometimes the skin may be the first signs of either infections or conditions within the body itself. So, yeah.
Wow. Okay. So
other than looking good, there's all these other things that
gosh. Okay, so that's a lot of things for us to think about, especially if you're watching and listening and you're thinking, do I need to go and see a doctor about it? Well, if it worries you, I think it's important to go see someone.
I think sometimes it's important to have yourself reassured and then be told on what to do to expect. You may have a mole there, that's okay, but sometimes moles do change. Okay, let's say if it's okay, it changes. You thought it was okay, but it's not. And then you may miss an early diagnosis for skin cancer.
Wow.
Yeah.
Okay.
So it doesn't matter whether it's a bumpy mole like the one I have beside my nose or one that's flat.
You want to see mine?
Stop showing me your mole. Where is it on your chest? Okay.
Yeah. So I mean, basically, we encourage people to have a check.
Yeah.
Okay. Or if you have anybody else at home with you, check each other's skin.
Okay.
We all have mobile phones. Take a photograph of your lesion that you have, and you go like, 3 months later, compare it, looks the same. You're not sure. Then you don't always have to rely on your memory for something like that.
Right.
Or I guess the next time you need to visit a GP, just ask the GP to just
Hey, what do you
do a
think?
check. Yeah.
Okay. All right. Let's just move on to this because people always are talking about anti-aging, how to look young all the time. The myth behind all the products that are being marketed online or in shops nowadays is just mind-boggling, right? How true is it though? I mean, do these things work? Can we
reverse aging?
If you
really?
could turn back time.
Time is
I mean, what are your thoughts?
Well, I think one of the things that is not always mentioned is genetics.
Oh, okay.
So I mean, some of us are blessed with genetics from our parents, obviously. That there's certain things that don't age. You look good for a certain amount of time intrinsically. There are also all the extrinsic factors. For example, sun, smoking, and various lifestyle issues. Okay, so for a healthy body, healthy mind, healthy skin, simple things like sleep, diet, exercise, not smoking, sunscreen, okay, gentle washes, moisturizers, topicals, etc. That all form a whole package rather than just...
So it's like a holistic package kind of thing.
Yeah. There are lots of things in the market that you can use and buy. and lots of trends along the way. But if you're unsure, like before you buy a phone, I go back to the phone again, you would do your research online and you have to find appropriate sources of information that are reliable. And then you go like, okay, I've done my research, I will buy the phone because I want this spec, that spec, and everything like that. Same for skincare products online. You have to see how believable it is, go through the evidence itself, and then if you're not sure, there are many doctors around that can advise you accordingly. A lot of people do various bits of medicine to do with the skin, and if they're not trying to oversell, or as I always go caveat emptor, let the buyer always beware. If you discuss with your doctor, these are your needs, these are what they can offer, you go with it. So it's not just one thing that will have a miracle, but a whole package that involves everything that sometimes we always don't want to do. As I said, the sleep, the smoking, sometimes
sleep, water lah, everything, diet
the
lah.
works, yeah.
Yeah,
Yeah.
indeed.
So it's not always, but of course genetics. I mean, if you've been lucky enough to have born with good skin, you may have good skin,
Yeah.
and after that some care.
I often tell dad and mum, like I'm really got the best of both worlds, because our dad, he has a lot of moles. I came out moley, and my mum grew up with a lot of pimples. Even right now, she still.
So you got them both lah.
I got both. I'm spotted all over.
Yeah,
So.
molly and pimply.
Yeah, thank you very much.
I'm just beautiful, thanks.
It's called makeup.
Not shy.
But right at the start of having this conversation as well, I'm wondering whether or not it's even important for us to be aware of what kind of skin type we have or are. Whether it's I hear it's 4 or 5 different types, right? Normal, dry, oily. Combination is sensitive. One of them.
Yes, I mean we have many patients who have sensitive skin, and sometimes this may be associated with other conditions, for example, asthma, allergic rhinitis, or what we commonly known as sinus, and of course allergic conjunctivitis. They've got itchy soft eyes, and it forms a whole package of people who are a bit more sensitive to environment and to the natural things around us. For example, dust, cat fur, pollen, grass, dog fur, etc., and or other things that we can apply on our skin. And the commonest things that people come to see us for are irritants from soap, especially during the COVID period where you do a lot of washing. Okay, and of course other topicals that we put on our skins, which may contain things like fragrances and preservatives, which some people may be sensitive to. And of course other people may also have allergies to other things like hair dye, or sometimes the hair dye, PPD, is actually in tattoos that people inject into the skin, and then they get an allergy on top of that. So there are a lot of things around that people can get potentially sensitive and or allergic to on the skin.
So what are the most common skin problems that you see as your patients, like eczema, for example, rosacea?
Okay, eczema, rosacea. I mean, my main practice is skin cancers, so I see a lot of lumps and bumps. Okay, and of course, people who come in for unusual sort of rashes. I mean, a kid came in the other day because she had a tattoo a fake tattoo done, and then she developed a reaction to it. Yeah, and so that is not uncommon. Okay, so we do a lot of things to our skin that is not always necessary for function, but more for form and beauty. For example, acrylates on the nails, people get reactions to that. Okay, people use contact with metals and stuff like that. So a lot of things can actually irritate and cause us to have skin problems. And after that sort of inflammation, then we left with some pigmentation, which people becomes very obvious. So people don't actually like that. So I always tell people, prevention is really better than cure.
Yeah. Does it matter if a product may say, organic or all natural, rather than, those with chemicals?
That is also difficult to say because many of the products, let's say for medical care, are regulated. Okay, if it's a medical product, it's a medicinal product, it has to be licensed and then tested. But for a lot of the cosmetic range products, they don't always have to have the same rigor.
Right.
Okay, it may say safe for sensitive skin, but that's what they put on the label. We can't be actually for sure unless it belongs to probably a reputable brand or a large pharmaceutical related brand. Then perhaps it's possible. So I always tell people to actually test it on themselves. We've all got skin. Before you apply, there's never any rush to
Like
apply
a
any products on the skin.
test patch or something.
You can put that on your arm. Okay, do that twice a day for a week. If nothing happens, usually it's okay. Then you try a small part on the rest of your face.
Your arm drops off, then don't.
If your arm drops off, you get so. Yeah, so I would tell people to do that because there's never any rush to try a product and then you lash it on your face.
Right.
So always try, especially if you're sensitive or if you have a history of having some sensitivity before.
I've had a friend who's I think it's a mutual friend as well. It's a chronic eczema, and to see the person suffer all the time, scratching, and then how does that come about? Because I had eczema once, and I realized
Did you grow out of it?
Yeah, because I stopped. So. It disappeared because I went for a blood test, and the doctor said, "Let's do an allergy test," and I found out I was really allergic to dairy products, and so I stopped it, and it stopped my eczema. Is that something that also happens, that you eat something and?
Well, I always very careful in these sort of situations. I mean, sometimes we can find the cause, but a lot of times we can't find the cause. But I'm glad that for you in your situation that you found you were allergic, potentially sensitive to dairy, and you stopped it, and
then they
went away. But for some people, even if they've done a test, nothing comes up, then it's a bit more problematic. If something comes up in the test, then perhaps if you avoid it, it may improve. But also, some people are genetically have more prone or have problematic eczema, which may need more than the usual sort of treatments, but with other things that are that have been developed for eczema. For example, various medications, injections or oral pills that you can take to help control the situation better. I'm being very careful not to recommend any brands.
No, of course. I mean,
anything that is.
But it's good to know that there
are
treatments
treatments
available.
And basically, you have to seek advice from your doctor.
Yeah, because hot lah, then itchy, and drink wine also cannot. Then hot, cold, everything affects it.
I mean, I think we're all very human. I mean, we have an itch, we start scratching it. But sometimes when we itch and we scratch it, we break the skin. And if it gets infected, and then the process just gets worse and worse.
Yeah, there are those small little gadget things that kind of just roll over, right? If it's really itchy, I think that those with eczema have those items that
it's like a little vibration sort of thing.
Is it?
Yeah, basically, yeah. So basically, itch and pain go on the same fibers. Okay, so but you use it's like a
rollerball.
Yeah.
Also, it relieves
it's a bumpy rollerball.
It relieves it.
So if you have an itch, people always scratch. That causes some relief. But I usually tell people either tap it or use a small little ice cube.
Yeah, that's what I tell your nephew to do when he gets a mosquito bite. Just tap, 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 tap.
Either tap it or put a bit of ice cube on and off. Actually, it will help rather than scratching it. Yeah.
I'd like to return to what you mentioned earlier, Martin, about how our skincare sort of changes through the years, through the decades as well. But let's talk about basic skincare regime before we also hear from you how exactly it should change as we get older with regard to skincare.
So, I mean, something overarching all the years will be sun protection. Okay, so different parts of the year. I mean, our skin is usually great until we hit puberty.
Oh, yeah.
Right? And then after that,
I still have puberty.
Yeah, you can get some acne and stuff like that, which is the most common thing. Okay, and then you treat that accordingly. One thing that people tend to do when they have acne, they get a bit more oily, so they totally wash off all the oil and everything like that. And sometimes that can trigger another problem. So actually, everything in moderation. So sun protection overarching, so a gentle cleanser or wash, okay, without any fragrance, preferred. Okay, and then a moisturizer and some and then of course the sunscreen accordingly. And if you have spots or anything like that, you can use topicals and or a retinoid depending on the situation. So that's your teens and 20s. Then as we get older, okay, you may consider other depending on the amount of sun you've had the years before, use some topical retinoids accordingly, and then make sure you're adequately moisturized. And if you travel a lot, okay, I tell people to make sure that because in the plane you're in air condition, in a hotel you're in air condition. Unless you're in air condition most of the time, you do dry up. Okay,
and the UV is so much higher in the plane.
But you're on a shell, so it's actually quite right.
Okay.
Right. So, and then of course, with that, you would make sure you're well moisturized, especially if you're traveling to a temperate climate. Okay, and then protect your skin accordingly. I mean, we wash our hands a lot. Okay, I wash my hands a lot between patients. So using some wash that's not too harsh and moisturizer along the way, and perhaps moisturizing at night before I sleep will be a way to protect. Because as I said before, the skin is a barrier, and various things that affect the barrier function can give you problems along the way, like a contact or hand eczema sort of thing. So, yeah. So wash, moisturize, sunscreen, and all the other things depending on what sort of skin issues you may have.
Because they always, all these products always tell us cleanse, toner.
Yeah.
I don't understand what
you
toner.
didn't mention
I
toner,
don't
though.
understand what toner does. Really.
Toner, suppose when you're
Close your pores.
in the earliest, in the earlier stages, let's say, would help reduce some of the oil and the grease. But as we get older, certain medications may come on board, and then we start to dry up.
So we don't need toner anymore. We become prunes.
tuner.
No, so basically you got to be very careful. So your regime changes.
I see.
Along the way, and the moisturizer that you use may have to change along the way too, because as you get a bit drier, as we get older, you have to use something a bit more
Olive
gao
oil.
No, but the thing about oily skin, combination skin, I mean, I think I've either got oily or combination, but I feel that I don't need moisturizer because I'm already oily enough. So what would you say to
different
that?
parts of the skin. I mean, you may feel oily on your face, okay, and usually face, chest, and back, but the rest of you gets drier also.
Yeah.
So you may have to use different types of moisturizers.
To your hand?
Yeah, my hands, a bit wrinkly.
see?
Yeah, so I mean, you may on the places that are a bit more oily, you may consider a lotion instead, and then use creams for the rest of the other areas. So lotions are a bit thinner and don't give you that sort of sticky feeling.
Clog your pores, yeah.
And then creams for the other areas because other areas are drier. We spend a lot of time on our face.
Yeah, we neglect
But
everything else.
and then we neglect. So the best way to age a person is look at the back of the hands.
See, mine. So
Okay. I'm very conscious.
and they also say the neck, right?
neck.
We always focus on the face, but not the neck, which is
Can you
part of
Botox
your
my
face. Kind of.
Yeah.
So
What do they do here?
what can we do with our necks?
So basically, no, the same sort of things that you protect your face with, you do to your neck.
Come down to your necks.
Yeah.
Okay.
Stop here.
And so you basically be very careful what you come into contact with. I mean, sometimes people wear chains and necklaces that they may be sensitive
or
to.
who you come in contact with.
And of course, I mean, we put a lot of sunscreen and stuff like that on the front part. Sometimes we forget the back, and then we get burnt on the back of the neck, and that causes further problems, you see.
Yeah.
Right. What's this? What are your thoughts on these new? I don't know, it's newfangled, but they also now we got vitamin C serum, vitamin E.
Collagen and stuff.
I mean, can you literally put all these things on your skin and expect it to become better?
And plump.
I mean,
A bit of yes and no. I mean, so as we get older, we do get a few fine cracks and lines and everything. So some of these serums and everything does help give you a moisturizer effect and cover up some of the cracks. But depending on how they're formulated, they may not cross the skin itself.
the barrier, right?
Yeah,
I mean,
to good.
yeah.
So I mean, they may just be more like
Topical.
expensive moisturizers. Yeah. So people say, how about drinking collagen and having all sorts of things?
Yeah.
They don't. I mean, you can't say, I'll drink this, then I want it to go to my right knee because it's painful.
because it
I
goes
can't
to
go
the
to my
liver and
skin. So
everything,
once it goes to the system, it will distribute it according to what the body wants and not necessarily what you want. So I mean, I'll be a bit more careful with sort of things, especially if you've done it for a while and it's not working. It doesn't work for you because not everything works for everybody.
Right.
Yeah.
Maybe we go into something a bit more controversial. Martin gasps. What are your thoughts on injectables?
I think everything should be done as in moderation and as a holistic sort of thing. You don't, let's say, some people only do certain injectables, okay? I mean, there are injectables like Botox, like fillers, and of course all the other like therapies, laser therapies, and ultrasound sort of things. So basically, I would advise people, know what you want, know what the limitations of what can be done, and repeat it accordingly depending on how it affects you. And you really do get what you pay for.
Meaning?
If it's too good to be true, you have to be very careful. Let's say you get lasers for $10. Okay.
Oh.
I don't think anybody does that. But for example, you got to be very very careful. What your
I see. But I mean, Singapore is quite regulated, right? In the sense that
Singapore is quite regulated.
yeah,
And then we should end it there because
Yeah.
I don't want to say, I can't say anymore.
yeah. I mean, I will admit now that I've tried the Botox thing.
Oh, you have? Where did you?
Can't tell, right? I'm smiling now.
Say your nose or your forehead or?
Rude. But it's interesting because if it's done wrong, it can be quite scary because you can't shut up, go away. You can't rectify it, and then you're stuck there like for 3 months, like that, looking very surprised.
So basically, the injectables work. Many studies for that, and sometimes some of these effects are operator dependent and how experienced the person is. So find somebody who you can trust and who knows what you need. And I tell people, say, hey, you should know what you want, okay, and what your goals are. Because sometimes if people say, what should I, doc, tell me, do something for me. What do I need done? I said, well, it all depends on what your goals are.
God made you, can I help you?
If I said that, I'll get this huge complaint letter, and then Hossan will go like,
Yeah, well,
complain to the Minister of Health.
Maybe I was born this way.
Yeah.
No, but I ask that because there's this things going viral now. The trend of the kids doing Botox and all that. It's like it's totally unnecessary, right? At the age.
Is it a Korean thing? Or?
I don't know.
I just read an article online about there's something called Sephora kids. These kids are influencers and they do go Sephora shopping. I think I go back to the whole holistic thing itself. With the social media trending of looking good and being good, and it starts from young and everything like that, it puts a lot of pressure on everybody to be perfect. But of course, we don't have the same genetics as everybody around us who looks perfect, and there's no perfect look, right? So I think at least for kids, I'll be very, very careful, unless of course there's any major skin issues that need to be covered up or decrease in prominence, not really suitable. And some of these products were made and developed for adults, which may cause a bit more irritation in children. So I'll be very careful, unless, of course, they are primarily formulated for children, which maybe moisturizers and sunscreens and washers are. But I'm not sure about the anti-aging products, because having sat here for 45 minutes, I think we've all aged 45 minutes along the way.
But we look better along the way, don't we? The light's very
Just
good.
smarter. But you're talking about all these very, very close to heart issues, not just for us slightly older people, but even for the young people, right? Are children actually being taught all these things that you're telling us in schools? Should they be? If they're not, you think?
I think
it's so important.
Yeah, I think it's very important. The school curriculum is always adding on things, and I suppose two parts here. Basic skincare, I'm not sure if it's actually taught, but people probably learn it from their families itself. And as I said, 3 basic things: sun protection, gentle cleanse, moisturizers as a basic, and then add-ons depending on situations. And number 2 is how to detect scams, right? We get scammed of money, but we can get scammed by products or by doing things that may not be the best for in our interest, because some of these things actually benefit the people who are providing this package more than the actual thing itself. And back to the children, I won't advise children to go for various things. I'm always very cautious because their skin is actually a bit not as mature, and may have other problems. But I don't do much pediatric dermatology, but I'm always erring on the side of caution.
So when does skin mature?
I would say there's no specific age. Okay, but I suppose in your late teens and early 20s, that will be super maturity.
You go NS already, you're mature already.
Yeah.
Kena sun.
Yeah.
We've got a show and tell here. You want to play with it?
Oh, yeah.
You brought toy.
I brought... I always,
toy, it's a prop.
I always bring this along with me to show what the skin is like. We think of skin as just itself, but you can see that there are different layers to the skin. Okay, the epidermis, the dermis, and the subcutaneous. You got the fat, blood vessels, hair follicle, various glands along the way, and different layers of the skin itself.
So how thick is that already?
Okay, so the epidermis can be about thinner, sometimes thinner than your hair, or maybe a piece of paper, and this will be about a few millimeters. But this few millimeters differs on different parts of the skin. Okay, so the eyelids will be quite different from your back, which has a thicker skin, and the places where have hair will be different. Okay, some areas are hairier, for example, scalp and the various areas, chest and back. But some areas have got no hair follicles itself. Hossan, where have you got no hair?
Definitely, he's got them under his armpit.
I think on
Your
my
palms and soles.
Oh, yes.
Oh yeah, of course.
Yes.
Why do you think of that?
I'm looking at my ribs.
Yeah,
Ribs don't have
okay.
hair.
Yeah, so there's some areas don't have actually hair. So
Oh.
yeah, so
Yeah,
and of
that's
course
something
the
new today.
palms and soles, because of the amount of contact and the amount of
Right.
trauma that does, it's thicker than normal. I mean, you can feel how thick your soles are. So I mean, yeah. So that's my little prop. So sometimes I use this to explain to patients which areas have got some issues, and then they understand that better.
So speaking of hair follicles, now I'm looking at it. If some women and some men do it, they want to get rid of them. Is that advisable? Like, armpit or
Yeah. So
I've seen those ads on social
right?
media.
IPL or something you
so
call it.
hair on the scalp keep.
Yes.
Not only the hair on the scalp has got one very important barrier function. It protects our scalp from the effects of the sun. Okay, so some people who don't have much hair on the scalp do have increased risk of skin cancers on the scalp. So I'm coming from a cancer point of view. But of course, hair frames the body, frames everything, and gives us a certain look, right? And if you want to remove hair, I mean, you can remove hair in various ways, okay? Just have to be careful that these ways don't cause more irritation or cause, let's say, ingrown hairs or stuff like that. Topicals, you got waxes, you got IPL, you got lasers and stuff like that. So it's okay,
Okay.
okay, but basically, like everything else, not to overdo it.
I see.
Yeah.
Okay.
Yeah.
No, it's interesting. I was to find out because sometimes, when I do shows and then from, let's say I'm supposed to be not have a mustache or a shadow, and then I do a matinee show, and then by evening, it's so irritating. Then the shadow comes out, and then I have to get shave again. Or so I was just wondering whether it was safe to remove it, completely. Yeah.
You can.
Sorry.
So, so best to have dark hair on paler skin for lasers itself, because the laser will target the hair pigment itself, and then so it's okay. So basically, be aware that sometimes you may get some side effects of whatever procedure you do. So careful lah.
Okay.
You've asked a very conservative dermatologist.
Well,
this
that's
sort of
great
questions.
though. I mean, it's
Yeah.
good to be conservative and then go from there.
Yeah.
Because
Okay.
you haven't had any skin care done at all.
No, but I do sometimes periodically just groan at the fact that the scars will be there forever. Should I do something about
really.
it? Not that my job needs it or anything like that, but things like that. Do you see a lot of cases coming through? Like, don't really need it lah, but if you want for vanity's sake, then
Yeah, I mean, I will advise people accordingly. I mean, basically, what are your goals and what has prompted you for this sort of things? I mean, I usually tend to leave things alone unless, of course, it's causing you a great amount of distress. It doesn't have to be physical distress; it can be mental distress. And then you can see which is the best thing for you to do to help you move you along that part, so that you can be a bit less concerned.
yeah, it is
a bit
well with
less
my
worried.
skin.
Yeah.
I'm fine.
So I mean, and then of course, if you have pressures, I mean, somebody says something, you go, hey, what's that? What's that? And a lot of people along the streets, wherever you are a bit unfiltered. So you have to decide that how much of pressure you have to listen to some people. But having said that, my only caveat to all that is that if someone points out something and you're not sure, okay, let's say it's an unusual looking mole, something that's growing, or something you can't see on your back. I mean, I had a lady with a growth on the back of her arm. It turned out to be a cancer.
Oh dear.
So, you can't always get it right in terms of what people say, but you go like, if you're not sure, have someone look at it.
What about skin tags? Because as I'm getting older, things are, I
Pop by, I
feel-
can set them off for you.
What's a skin tag?
Skin tag
Extra
is-
bit of skin
it's
that
like
goes
suddenly
up,
you
yeah.
get this skin.
Yeah. I got some. Never mind. I shan't
Yeah,
tell you
no,
where.
yeah. Anyway,
So I mean,
you can get rid of it.
you can get rid of some things, yes.
Oh,
Yeah.
Oh, okay. But let's say it's on the eyelid. All can be done.
Can be done.
Oh,
So basically, you're going to find someone who's happy to do that for you, and it's not very difficult to do.
It's not very intrusive either, right?
Not very
It's
intrusive,
just-
yeah. It's
just
all
a snip
it's-
or a laser
yeah.
or something.
Yeah, a snip or electrocautery or electrosurgery. So that's
I
quite easy
see.
to do.
Yeah, because I was starting to get it worried. Like, it's like, what's this? Is it? Then you feel things. Why is this bump here and all that stuff? Yeah. So and what is this thing about liver spots? Why do they call it liver spots?
It's a very good question. I mean, I will check out my book, which I brought along.
Yes.
because it's a nice prop too. But I think it's probably called liver spot, not to say that you've got any problems with your liver, but
Yeah.
the color is probably what a liver looks like. Brown.
Okay.
Yeah.
Liver color.
That's quite gross.
Yeah. So I mean, so cooked liver is probably
Yeah,
but
it's
that
like,
color.
it's like pig liver, right? Like
Yeah.
that.
So it's probably called because of that. But I mean, if we can always Google to check
Yeah.
what
Also,
the origins
what
of something
causes
like that.
liver spots, though? I mean,
All part of extrinsic skin aging from sometimes either something that's hereditary, if your parents have had
Right.
that, or from the sun itself. Cause all this pigmentation on the
okay,
skin.
so we're dispelling the myth that liver spots are not caused by the liver.
It's not caused by liver.
Okay.
Yeah.
Thank you. I was getting very stressed about it then.
Oh, you eat too much liver? No.
No, right?
No. But having said that, sometimes skin signs may tell you that something is going on inside. Okay. When you mention liver things, if you have any liver issues, I mean, you may get unusual blood vessels, you may get a bit more redness some places. So, I mean, that will tell the doctors that you may look out for certain things associated with what's happening inside.
Because this is just from a personal point of view. If I had a little too much to drink the night before, the next morning I get bumps on my chest and they're itchy. So I attribute that to that's my body reacting to the alcohol the night before.
Which is, I mean, people do react to alcohol in different ways, and one of the things is some people do get hives, which are usually short-lived, and then they go away once the irritant or the potential trigger has resolved. So it's not uncommon also.
Okay.
Yeah.
It's free consultation, so fun.
Just drink less then.
No, I mean, I do it all the time.
Yeah. So I mean, basically, I mean, skin is great because we can see what's going on.
Yeah.
I can't tell you how your heart is. I can't tell you how your liver is. Can't tell you what your lungs are. But skin, we can all see it for ourselves. So that sometimes we pay more attention to it, and that feeds on our worry. Or sometimes even picking. Let's say you got a skin tag, like pulling in it, picking in it. That's not uncommon also. Yeah.
And since you've dealt so with so many cases about skin cancer, with regard to skin cancer, does it usually occur in isolation of other cancers, or can it actually spread as skin cancer to some other part of the body and it becomes something else cancer?
Okay, we can divide that answer into three, I think.
Wow, okay.
So you have a primary skin cancer that is isolated, okay, and it is there, it happens, you cut it out, it never happens again. You may get another similar skin cancer elsewhere, but it's probably not related. Okay, then there are genetic forms of skin cancers, which we will not go into, but people have got a genetic mutation and develop multiple skin cancers, and then that is a separate issue. The third part of the question is that you have an internal cancer somewhere, let's say a lung cancer, breast cancer, okay, and then part of it has metastasized or spread, pops out on the skin.
Oh.
That's another possibility too. Those are some of the, and then the fourth type will be the patchy sort of skin cancers, which T-cell lymphomas and stuff like that. Okay, which is a different sort of thing. So there are different types of skin cancers, and they can happen in different sort of situations.
Okay.
Yeah.
All right.
Because I've seen my friends and people in Australia where I'm just going for my skin cancer treatment, and then they come out and then it's cut or it's burnt off, and then it's whatever.
Yeah.
And because to me it's foreign to me. I've never experienced something like that. So I was like, oh, really? He says, yeah, very common. I'm just going for my skin cancer.
I mean, one of the famous people, if you follow the news, is like Hugh Jackman.
Yes, I saw that.
Wolverine, yeah. He's got like, don't know how many skin cancers on his face, and it's all been cut out, and he's still doing things. So for something like that, I mean, early surveillance, early detection, and early treatment would be ideal, as with most medical issues.
Okay, good. Something to take note of.
Yeah, indeed. I also want to go back to something you mentioned earlier about, face wash and even hand soaps and all. You mentioned make sure it's gentle, it's not going to be harsh on the skin. How do we tell whether a product is harsh or not?
Immediately after use, if it's tingling or you get a bit poking or sore, okay, it might be a bit harsh for you. For example, a face wash. You wash your face, immediately after that, if your face feels like cracking or it's got this poking, burning sensation, it might be a bit too strong for you. So sometimes people also use too much.
Right.
Rather than the pea size that's actually needed to lather up, okay, that can be a bit more sensitive for you. And sometimes foaming products that foam tend to dry the skin a bit more. And then when your skin gets progressively drier, it can get a bit more sensitive also.
So water's not enough lah.
You can use water.
But it's still going to be oily though.
I mean,
Yeah.
you need some
You
barrier,
need
right?
some
You need
oil,
oil.
to form the barrier and to maintain the barrier. So I think that's okay.
So water is,
Yeah.
I mean, yeah, I guess so. Because sometimes, like in the morning, I get up and I've slept all night, right? So I just use
We don't know
water.
how dirty your bed is.
Well,
Hossan.
yes, I'm very
Don't smell
clean
like your bed.
sleeper. Like, okay, it's good to know. Water's good enough.
Yeah, no, because I mean, many people shower before they sleep.
Yeah.
You don't get very dirty when you're asleep. Okay, so I mean, sometimes people shower 3 times a day, 4 times a day, and you don't always have to use soap depending on your activities, lah.
Okay.
And then for men or women, sometimes people wash certain sensitive parts with harsh things, which I think is not a good idea.
Yes, keep the Clorox for the bathroom.
Yeah. So yeah, but yeah. So basically, your skin is gentle. You be gentle to it.
Okay.
And we want to talk about hair. Some people use very harsh hair products. Okay. And when they wash their hair, they scrub and then they vigorously towel dry. Hair is most fragile when it's wet.
Right.
So be gentle to it too.
Wow.
They probably have that, tune in their heads, especially women. I'm gonna wash that man right out of my hair.
Well,
I think South Pacific dates you a
Yeah,
bit.
so specific. Yeah.
Yeah, we are a dated host pairing.
Speak for yourself. Anyway, on that gentle note, thank you, Martin, for joining us on the Yong form. And we've gone more than skin deep. I can't believe you wrote this.
Yes, he used my script.
Skin deep to help us understand skin health. But you really brought a lot of pertinent topics up, especially with regard to sun. And keep it, especially for young kids, young parents out there also, to help protect the skin for their children.
Point taken.
Yeah. So thank you very much. Any last things you want to bring up so that we can, our audiences will be able to take home with?
Well, I am basically prevention is better than cure.
Yeah.
Okay, and if you're not sure, there are websites you can look up. And remember, skin is also a part of your overall health. So protect it. Be gentle.
All right. So this is Hossan.
This is Stanley.
On the Yong form. We'll see you next time.
Take care of your skin.
The Yong Form podcast is brought to you by Double Confirm Productions.
That's right, and you can stream and subscribe as well as scream all about it off our show on all major podcast platforms. You're talking about Spotify and Apple.
And we're also on YouTube, so don't forget to like the YouTube channel as well as subscribe to it. Make your comments there, leave everything, ask questions and all that. And we will also update you on the brand new episodes that will come along.